Hello, future Rossies and pre-med explorers. This is Milena Garcia, your host for Ross University Checking the Pulse, a pre-med podcast. This is our mini podcast featuring facts and information about our medical program, insights from current students, and tips from practicing physicians. Each week, this broadcast will be broken down in small episodes, focusing on one aspect of our program, also having guests talk about their own experiences as students and as doctors. Ross University School of Medicine is dedicated to setting a vision and commitment to action for addressing racism and fighting for social justice. We believe racism is a public health crisis and it has to be addressed. Our teach values, which are teamwork, energy, accountability, community, and heart, are our guide as we embark on this first step in a long journey. In this episode, we will talk about RUSM's Diversity and Inclusion Taskforce and the initiatives driving the changes. My guest is Dexter Francis, facilitator for the RUSM Diversity and Inclusion Taskforce and coordinator for campus programs. Well, hello, everybody. This week, we have Dexter Francis with us. Dexter, thank you so much for joining us. He's going to be talking about our Diversity and Inclusion Task Force. Dexter, why don't we take a moment to have you introduce yourself to our audience?
Great. Thank you for inviting me. I am Dexter Francis. I've been with RUSM for almost 2 years now, and I have worked in the Department of Student Affairs as the coordinator of campus programs. I'm also the facilitator of the Diversity and Inclusion Task Force. My involvement in the diversity and inclusion space is as a result of my involvement with work with the SGA students clubs at RUSM. I recognize that in spite of the representative diversity apparent in our student body, and to some extent our colleagues and faculty, there was a need to bring our diverse community together in a meaningful way. One of my goals was to create a forum for discussion that would bring people together so that we could appreciate and be informed about our different experiences and life journeys.
This is a very important initiative, and we're happy to have you here to tell us a little bit more in details of what this entails. So tell us, what is the Diversity and Inclusion Task Force, and who's all involved in this initiative?
The Diversity and Inclusion Task Force is comprised of a group of faculty, colleagues, and students charged by the Provost of RUSM to make recommendations to the Office of the Provost for Diversity, Equity, and Inclusion. We have faculty from the Clinical and Medical Foundation Sciences, the Chair of the Curriculum Committee, the Manager of Accreditation, Dean of Student Affairs, Dean of Clinical Sciences, President of RUSM Alumni, Human Resource Managers, Chair of the Employee Engagement Committee, Communication Managers, Director of Equity and Access, and students from the Clinical SGA, from the Basic Sciences, as well as just students from the General Clinical Rotation and Basic Medical Sciences.
This is a team effort for sure. A lot of angles being hit at the same time from different directions. And ultimately, what is the vision of the task force?
RUSM strives to help create a just and inclusive society free from racism, discrimination, prejudice, injustice, disparities, and inequities. In that regard, it is envisioned that RUSM will be a place where all employees and students experience diversity and inclusion, and RUSM graduates a diverse pool of physicians, culturally competent and equipped to mitigate the healthcare disparities and inequities experienced by the marginalized of our society. Important to the vision that we have for an inclusive and equitable climate at RUSM, we recognize that real, meaningful, and sustainable change within our institutional community and the society at large will only be realized when individuals embrace the significance of this endeavor and take ownership. We can make a difference, one person at a time.
And what is our institutional commitment as an organization?
We are committed to a social justice mission, which is founded in the principles of learning and advocating. Therefore, actualizing RUSM's commitment of educating, listening, learning, studying, and acting, we will ensure that we embark on a sustainable mission for social change, intentionally and deliberately. Our resulting actions will be driven by empirical data and evidence. We want to get beyond this decades-old phase to a place where change is reflected at RUSM. And through advocating, we will be the vanguard for social justice and change. RUSM is a medical educational institution, and so we have an important role to play in ensuring that the next generations of physicians have the competencies to provide healthcare to patients as necessary for the demographic diversity of the population, and so help mitigate the public health concerns that result from disparities and inequities in the healthcare system.
You're talking about the involvement from our administrators and faculty. What do we expect from our students?
We expect our students to help us create an environment of inclusiveness. We expect that our students will become competent physicians who are the drivers of social justice. RUSs, as our students are known, have a unique opportunity to experience a diverse community of students, faculty, and colleagues. Through a structured framework, RUSs will have an opportunity to appreciate the value in diversity and to recognize and embrace diversity. When they graduate and practice as physicians, they will demonstrate the qualities and competencies necessary to provide appropriate healthcare to all patients.
And how does this initiative impact our curriculum, or does it?
It does affect the curriculum. The curriculum of RUSM will evolve and incorporate evidence-based best practices to ensure that our students are educated and acquire the competencies that they need. We will also incorporate the standards within the curriculum as stipulated by, and in some cases, go beyond the standards of our accrediting bodies.
And what are some of the steps that we're taking to ensure that this initiative continues strongly?
By increasing diversity, we will further expand the diversity of our student body, faculty, and colleagues, therefore expanding diversity in the medical healthcare workforce, and so mitigate disparities and inequities in the healthcare outcomes for underrepresented minorities. By rooting out systemic bias, we will ensure that our educational programs, systems, and processes are free from any implicit and explicit bias within our institutions. By communicating, we will share our action plans and progress while also leveraging our platform to inspire internal and external change. And by partnering, we will partner with organizations that share our values so we can collectively address this public crisis and influence the healthcare industry, the professions of our students and alumni, and the communities in which we live and work. With these efforts, we anticipate creating an excellent teaching and learning environment for our students and a truly diverse, equitable, and inclusive environment for our community.
This is really incredible. You just listed 4 major initiatives that we're doing: increasing diversity, rooting out systemic bias, communication, and partnerships. This is great. And ultimately, what you see our goals as?
Our goals are to educate future physicians and to provide them with competencies to serve the increasingly diverse population, to graduate exemplary students who drive social change and mitigate the healthcare inequities and disparities in healthcare outcomes, to have leaders who are inclusive, transparent, and demonstrate accountability, to create a diverse, equitable, and inclusive, supportive environment at RUSM, which is free from all forms of injustice, inequity, and discrimination, and where all members of the community know they belong and are appreciated for their differences and have equal opportunity.
Dexter, I really appreciate you taking your time to join us here to share a little bit more details about this very important initiative that we have here at RUS, the Diversity and Inclusion Taskforce. Do you have any last-minute recommendations for our future RUSs?
I would highly recommend RUSM and encourage future RUSs to take advantage of this opportunity to experience and learn in a truly inclusive environment. So take advantage of this opportunity to become a RUSI.
Agreed. Take that opportunity. Everybody listening, let us know how we can help you. Dexter, one more time, thank you so much for joining us and sharing your time to talk a little bit more about this really important initiative. Everybody out there listening, thank you for joining us. We appreciate your time, and join us next week for our next episode.
Well, thank you, and have a great day.
Thank you. You too.
Thank you for listening to Ross University Checking the Pulse, a pre-med podcast. This is Milena Garcia, your host,
This podcast is made for you, so let me know what topics you want us to cover on future episodes. You can send me your comments, feedbacks, and requests to mgarcia@rosu.edu. Definitely follow us on Instagram, Twitter, and our YouTube channel at Ross Med School or on Facebook. If you're listening to this podcast on iTunes, I am working my way to 5 stars, so remember to send me your comments and let me know your ideas. If you're on Spotify, remember to click on the follow button to get our future episodes. All right, see you future Rossies and Pre-Med Explorers next week. This mini podcast is edited and produced by our in-house guru, Chris King.